So tell me about those drugs again, and which ones are difficult to get and which ones are easy for the physician to write.
The popular class of these injectables are semaglutide or Ozempic and Wegovy, Mounjaro, Trulicity. They are molecules that are promising in that they help a significant amount of people, a big bunch of them, lose a fair amount of weight. They also help reduce the risk of heart attacks and strokes. So the number one cause of mortality in our patients with diabetes is heart disease. Well, these molecules help likely prevent diabetes because of the promise in weight loss, and they also help reduce the complications such as heart attacks and strokes. The challenge has been, and you know this, all over the country, everybody wants to put them to work. They're going to any place they can lay their hands on it. But I'm hoping that access becomes easier for a lot of people in the diabetes space and maybe even in the pre-diabetes space.
Now, you said Mounjaro, Ozempic, Wegovy. So with those, is there one that seems to be easier to have access to versus the others? All right, it just depends. Everybody's different, and you have to go to your computer and see which one that insurance company will make less of a financial burden.
Yeah, I think it's more of the latter. I think when we're looking at which one to try to use or for our patients, we're leaning on which one is best available or accessible. So there are minor differences in the family of molecules, but I say whichever one I can get for you is the one you'll get.
Where do you inject it?
It's injected in the belly. It's important to continue weight training, eating smart, because we don't want muscle mass loss. We don't want people to just lose the weight. And again, I say this all the time. It's the A, B, and C of diabetes. The hemoglobin A1C, we cannot forget the B and the C, which is blood pressure control and cholesterol. So it's the ABCs of diabetes care, not to just be focused on the A1C.